I have believed in the NCCN guidelines and the importance of guidelines and the importance of guideline concurrent care my entire career.
– 2025 represents the 30th anniversary since the NCCN was first founded.
And so I think that the 30-year anniversary should be a celebration of impact.
And every single day, as we're speaking now, there is an oncologist with the patients and the caregivers in an office who are using the NCCN guidelines within the consult room and the clinic to make treatment decisions about that patient.
Everyone has the same access to this information, which means that everyone has access to these recommendations. And, that's 30 years of expertise and knowledge that has been generated and continuously is generated. And that just means that the next generation of patients with the cancer my dad had, or even for that matter, the cancer my mom had, are going to be better off.
I would also say this is a great example of the power of volunteers. NCCN is a volunteer organization, and our panel members and people who participate in other NCCN activities devote thousands and thousands and thousands of hours every year.
There are now 88 guidelines, and they cover an increasing spectrum of not just adult tumors, but supportive care guidelines and pediatric cancers.
Every study that I'm aware of looking at cancer clinical practice guidelines demonstrates that the NCCN guidelines are the most widely utilized guidelines in the U.S. and outside the U.S. All of this serves to increase the quality of cancer care wherever the guidelines are used.
One of the things the NCCN does very well is keep up with the innovations that are coming our way. As cellular immunotherapies expand and new FDA approvals come on board, the NCCN guidelines are updated annually. There are many oncology societies in the United States. Some of them are professional societies, several nonprofits, but the NCCN stands above these in my mind with regard to its influence not only on actual daily practice, but also patients' perceptions of what we do, and also with government policy.
NCCN is recognized nationally, not only by CMS, Centers for Medicare and Medicaid, as a reimbursement model, but also by Congress, where the NCCN breast cancer screening and diagnosis guideline was recently held up along with the American Cancer Society's breast cancer screening guideline as an evidence-based model for women for the early detection to improve their outcomes if diagnosed with the disease.
NCCN offers the ability, whether you live in the most rural part of the United States to the biggest city in the United States, to receive the best data-based, research-based practice and treatment for all cancers that providers might treat. The stretch and reach of NCCN is absolutely incredible, and you think about that both nationally, but internationally as well. Cancer care is going to change dramatically over this next decade and beyond, and to have an organization dedicated to making sure that the best care possible is provided to patients, but to do that in an equitable way, to make sure that access is available, and to make sure that these resources are available to all patients and their providers. That's an incredible mission, and very excited to be a part of it.
And I see the future of cancer therapy continuing to be bright, where we are better able to personalize the treatment of a particular cancer for the patient in which that cancer presents.
I think it's going to become more difficult for the community oncologist to integrate all of the latest information. That's where the NCCN guidelines will play a really important role.
How do we ensure that our guidelines are getting to everyone? And then how do we include the other social factors within our guidelines that can help individuals
When I think about the future of cancer care, I envision a future where we catch cancer early when it's most treatable and we can make the most impact on patients' lives.
For the clinician community, knowing what people in the large academic cancer centers are doing and largely why they're doing it, which comes from the manuscript portions of the guidelines, is very, very important. People are treating wide numbers of diseases, and they can't always keep track of what's going on in some of the ones that they don't treat every day. So it's really great to have available to them really authoritative information.
I think every journal has to step back and assess the landscape and decide what's important now. One of the things that's so pervasive now is AI. I mean, it's permeating every aspect of our lives. And so I think keeping current with what people are interested in is probably the most important thing an editor-in-chief can be doing in terms of positioning the articles in every issue to sort of reflect what people are interested in.
You know, one particular thing that I am sort of most excited about is also the health equity report card and the health equity focus that NCCN has really stood up and supported. And I think the NCCN's sort of focus on health equity and understanding that there needs to be intentionality validates and actually supports the broader sort of understanding and efforts in this space.
My thought is that the best way to practice good cancer care is to make doing the correct thing or the right thing the easy thing to do.
I think we look forward to another 30 years of continued success and continued growth, and hopefully bringing some good to the world and helping in the fight against cancer.
Happy anniversary, NCCN and NCCN Foundation. I'm incredibly proud to be a part of this organization.
Happy anniversary, NCCN. I've been so proud to be a part of this organization for many, many years, and I look forward to many years coming.
We want to wish everyone at NCCN and everyone that supports its activities and its mission happy 30th anniversary.